Hello, in this presentation we are going to talk about the common procedures done for management of heart disease, and I'm going to explain, at least try to explain these procedures in simple, easy to understand terms, and I believe that this is the stuff you should definitely know. Alright, let's first start with coronary angiogram. I'm sure most of you have heard this term at some point or another. In this procedure, once your cardiologist makes the determination that you will need to have it done, you will be taken to the hospital, and after giving light sedation, a catheter, which is a very thin hollow tube, is inserted into a major artery called femoral artery in the groin. Now this catheter will sometimes be sent through the one of the arteries in the forearm, but it's most often done through the blood vessel in the groin. And once it's sent into the artery, it is advanced through the arterial system into the opening of the coronary arteries, and this is done under X-ray guidance. Then a contrast dye is injected into the catheter, which will flow through the coronary arteries. The images are then captured by an X-ray machine, and multiple images are taken to assess the main arteries as well as their branches. Now these images, once the whole procedure is finished, will show if the arteries are normal or if there are any significant blockages. Here's the procedure we just talked about, coronary angiogram. Catheter being inserted into the femoral artery, and from there being advanced through the branches, the main arteries, into the aorta, which is the largest artery in the human body, and from there into the coronary arteries. Like I mentioned before, the same procedure can be done also from or through an artery in the forearm. Another image, this time of a shot of an angiogram. Now this is just one image, and there are multiple images taken usually when this procedure is done. Let's talk about angioplasty. Now angioplasty is typically done when there are blockages. So if your angiogram is normal, that is great news. On the other hand, if it's showing significant blockages, your cardiologist may proceed with an angioplasty, and typically this procedure is discussed with you prior to an angiogram being done, just so you're aware that there might be more than one step involved in the whole process. Now angioplasty, bear in mind, is suitable only for certain types of blockages. Your cardiologist will make that determination, and this will be based upon the findings of your coronary angiogram. So what exactly is angioplasty? It's also known as balloon angioplasty. Now the procedure is pretty similar. It is again a catheter being sent through the groin to go up to the coronary arteries, as in an angiogram. Now this catheter is different, and it's unique in that it has a deflated balloon at its tip. This catheter is gently advanced into the site of blockage in the blood vessel. Then the balloon is inflated. What this inflated balloon does is it will flatten the plaque that has been building up over the years, and that is causing that blockage within the vessel is flattened by this inflated balloon. And subsequently, the blood vessel, the coronary artery, or the main one or one of its branches, will open up to let the blood flow through it again. And once the cardiologist who is doing the procedure is satisfied that the blood flow is adequate, the catheter is removed. Here's an image demonstrating the procedure. You see the deflated balloon in the artery and plaque surrounding it. Then the balloon is inflated, which compresses the plaque and opens up the artery again, so the blood flow can be restored. Now there is another procedure that you will need to be aware of, and this is angioplasty with stent placement. With balloon angioplasty alone, there is a possibility that the artery will become blocked again after the procedure. So these days, in the vast majority of patients undergoing angioplasty, stents are being placed. Now this stent is basically mounted onto the deflated balloon, and as you saw in the previous slide, the balloon is sent up to the site of blockage in the artery, and the stent is on the deflated balloon, and once it reaches the blockage site, the balloon is inflated, which in turn will cause the stent to open up and it will lock into place in that position. This stent will then stay in the coronary artery permanently. There are two main types of stents available at this point in time. They are bare metal stents and drug-eluting stents. There are newer types being researched on and that are being released into the market. So what exactly is a stent? It's actually a small mesh tube that's made of metal. Bare metal stents obviously are basically bare metal. One disadvantage that these stents have is that clot can form on this stent, causing the artery to get blocked again within the first few weeks after the procedure. Now, drug-eluting stents have a medicine coating on them to prevent clot formation. They are more expensive. Now, these stents to have a disadvantage in that a clot can also form on these stents, but much later than with bare metal stents. This can form many months after the procedure and sometimes years later. So after placing these stents, either of these kinds of stents, specific medicines are prescribed, and these medicines from the majority of patients undergoing these procedures are aspirin and clopidogrel. Bear in mind that there is another combination that is also being prescribed, but this is the most commonly prescribed combination: aspirin and clopidogrel. The reason why I mention names of these medications is because it is extremely important to take these medications for the prescribed duration, and the duration can vary anywhere from a month to a year, and sometimes even lifetime. If you for some reason stop taking the medicines without talking to your doctor first, what could happen is that life-threatening blockages might develop in these arteries, which of course can sometimes lead to death. So it is extremely important that you keep in mind that unless and until your doctor says so, you should continue taking these medications as prescribed. Now, for most patients undergoing these procedures, other medicines are also prescribed, and these medicines are prescribed to help control blood pressure, keep the heart rate under control, as well as cholesterol under good control. You see on the left hand side two different kinds of coronary artery stents, and the image on the right hand side is basically showing the procedure. You see the blockage site when the blood flow is markedly compromised, and after procedure and stent placement, the blood flow is restored. This is part one of a two-part presentation, and I recommend that you also watch the second part to get more information. Thanks for watching.